Hi everyone, it's Tara Bianca with Be Light Transformative Therapy, and today I want to talk about how to address the scalenes on yourself. So we'll talk a little bit about why you might want to address this area in general. We'll take a look at the basic anatomy, we'll palpate the area, and we will specifically address these muscles. Your scalenes are those rather small, deep muscles in the anterior lateral neck. Most people have 3 of them, so there's an anterior one, there's a middle one, and there's a posterior one. And so whenever there's tension here, too much tension, or you start to develop trigger points in this area, it can start to cause some crazy referral pain up and down the arms and also into the upper chest. And then if there's any postural imbalance or muscular imbalance in this area, you can also start to compress the brachial plexus, which exits between the anterior and middle scalene. And you can also start to compress the subclavian artery. And so what's the result of that? You can start to experience nerve pain up and down the arm, so any type of paresthesia, numbness, tingling, lack of sensation or too much sensation, burning. Or we also tend to have poor circulation because we're compressing that major artery. The scalenes are classically involved in most cases of thoracic outlet syndrome. So maybe that's even what brings you to this video. If you have thoracic outlet syndrome, especially neurogenic, the neurogenic type, this can be a really functional and useful exercise for you to learn how to start to release some of the tension around that brachial plexus in order to help alleviate some of your symptoms. And then also people with extreme respiratory dysfunction. So think COPD or emphysema or serious asthma, or even people who tend to be stuck in chronic hyperventilation, people with a lot of anxiety or an overactive fear or panic response. They tend to overuse their scalenes, which are accessory muscles to breathing. They tend to overuse those accessory muscles to breathing, and these muscles get overused, overactive, and create a lot of symptoms and issues as a consequence. Since this muscle group is a bit deeper, normally I would want to take the time to warm up the more superficial tissues and muscles first, so specifically your SCM. But for the purposes of today's video, I want to kind of keep it brief and condensed, so we're just going to dive in and go for it. If you'd like to see a demo of some very simple SCM work, you can check out this video right here, or you might also enjoy my brand new Self-Massage for Anxiety Relief video series, which you can find in my Be Light store. Okay, so as usual, the best way to sort of address a specific area of the body is to palpate it first, meaning we're going to very gently touch this area and get a sense of the basic anatomy, the basic structures, and how one structure is related to the other in terms of its geography and its location. And what you'll normally find is as you're just palpating the area to get a sense of where you are and where these specific muscles are, is that even just the palpation starts to feel like a gentle treatment and can start to create some change in the system, create some change in the muscles, create some change in your nervous system. So scalenes, where are they? So they're anterior lateral neck, right? And they come off of the transverse processes. So these are these projections off of your cervical spine. So these transverse processes of the cervical vertebral bodies. So just go ahead and palpate the side of your neck. And if you find the side seam of your neck, you'll notice there's just a bony wall that you keep running into, right? And if I go a little anterior, I run into my SCM, I run into a lot of soft tissue. And if I go too far posterior, I kind of fall off the grid, right? So there's a point right here in the middle where you just keep running into this very dense wall. So those are your transverse processes of your cervical spine. You really cannot miss them. And if palpating in this way feels a little strange, you could always take a hand and kind of grab from behind So as if you were massaging your own neck. And what I like to do sometimes is laterally flex or side bend the head towards the side that I'm feeling. And what that does is it softens all of those tissues so that I can sink my fingers in and feel a little bit more toward the bone, which is obviously deeper than the muscles, right? So I'm just feeling for that bony ledge, that bony ridge, that bony wall. And you can kind of do this on both sides. I'm going to take the other hand now and just come from behind. And I'm going to laterally flex my hand onto my head onto my hand. And I'm just feeling, getting a sense of where the muscles are, where the bones are. And it should feel pretty good just to kind of warm up the tissue in this way. Or we can take the thumbs maybe and just dig into the side here, dig into the side and kind of get a sense, maybe bending from one side to the other and just kind of feeling that bony wall all the way up and down the neck. So this is really where we're going to be focusing our attention today. So how do we differentiate now between, say, the anterior scalenes, the middle scalenes, and the posterior scalenes? Because remember, there's 3 of them. And in fact, on some people, there's a 4th one, but most people have 3. So how we're going to go about it is we're going to get our SEM out of the way. So this is that very superficial muscle. We've worked on this in other videos, so you can go back and check out those videos. I'll link to them in the video description. We want to get this guy out of the way. So I'm just going to push him forward, right? I'm just pushing that SEM forward. I can even use my other hand to grab it and get it out of the way. In fact, this is kind of a nice way to warm up this area, is just to drag across it with your finger pads. Okay, so I'm pulling SEM out of the way, and then I'm going to take my fingertips, my finger pads in this orientation. Remember, I'm going to be on the bone, and the cervical spine, the transverse processes of the cervical spine are behind SEM, right? So I want my fingers facing the thing that I'm going to be working on. So I'm pulling SEM out of the way, and I'm just sinking my fingers behind it. So my fingers are oriented like this, and all I'm doing right now is I'm feeling the pads of my fingers pressing gently back into that bone. I feel that bony wall right behind my fingers, and I'm not going with intense amounts of pressure. I'm just pushing in, coming back, and putting a little bit of drag downward towards my shoulder without even really moving my fingers. So this can be a really sensitive area to work on, especially if it's problematic for you. Especially if you have trigger points there, especially if you have some breathing disorder, some breathing dysfunction that's causing you to overactivate this area. So go gently if that's you. And right now I've just got my fingers pinned, right? So I'm behind my SEM. You can see the SEM is totally clear. I'm right behind it, and I'm just sitting here. And as I'm sitting here, my fingers are sinking deeper, deeper into that space. They're coming back a little bit, falling into the transverse processes of the cervical spine, and they're dragging down just a little. They're just gesturing towards my shoulder. And I'm just sitting here and I'm breathing. So anterior scalenes are located on the anterior tubercles of the transverse processes. So you don't have to feel all this today, but know that they are connected more on the front part of those transverse processes, whereas the middle and posterior scalenes are located on the posterior aspect of the transverse processes. So right now we're on that anterior aspect of the transverse processes. And if you just gently glide up and down a little bit, you'll even start to feel those tubercles. I'll put a picture up so you know what I'm talking about, but it's almost like there's these little bony ridges on the front of those transverse processes. And now if this is feeling very tight to you, very tense, very uncomfortable, you can go ahead and do the action of the muscle in order to slacken the tissue and get in there further. So I can laterally flex towards the side I'm working on. I can bring my chin a little to my chest, so going into flexion. And in this case, for the anterior scalene, I'm going to even think about rotating away from my hand a little bit. So I'm really slackening the tissue. My fingers are pretty relaxed. And I'm just gently going up and down on that fiber. Now remember, this is an accessory muscle to breathing. It connects to the first rib, which is deep to your clavicle, right? It's deep in here. So if I do a forced inhalation, like I should feel my scalene almost push my fingers out, right? I can feel like my fingers being pushed out and in, out and in, out and in. So that's another way for you to verify that you're on that muscle. You should feel it pop when you take a really forced inhalation that is strong enough to activate your first rib. Good. And now I'm just gonna move myself down a little bit. So again, I'm gently coming in. My finger pads are gently pressing backwards into the bone, into that cervical spine, those transverse processes. I'm gonna flex my head towards my fingers to slacken that tissue a little. And the more we go down towards the clavicle, the more likely we are to potentially run into some sensitive structure. Like we might start to run into the brachial plexus if our fingers are not in the right spot. So if you get any sharp nerve pain, burning sensation, numbness, tingling, please remove your fingers and adjust and try again. You don't want to cause any damage to the brachial plexus while on the journey of trying to heal your body, right? We're not trying to cause more harm during this exercise. So I'm just sinking down. You can see I'm pretty low now. I'm getting pretty close to my clavicle, but my fingers are still gesturing backwards. And again, I'm testing it by breathing in sharply, and I can feel my fingers getting pushed out. And so the only trick with anterior scalene is that you just want to really be behind SCM. You want to clear SCM. It's deep to SCM and it's a little posterior to SCM. Good. So that's anterior scalene, really simple. I think the best way to work on it and the most gentle way to work on it is just to kind of pin it and breathe. Pin it and breathe. And the more you breathe and relax, the more the tissue starts to open up, the more deeply you can sink, the more deeply you can connect with that muscle. So forcing your way in there and going as hard as you can and really stripping the muscle is not always going to be the most effective thing. Sometimes with these more sensitive areas, it's more effective to be really gentle, be a little patient, and just allow time and your breath to help you sink into those structures. Okay, so now we're going to kind of address the middle and posterior scalene as a couple, as a group, because they really attach to the posterior tubercles of the posterior transverse processes of the cervical spine, right? Now, the middle scalene starts to connect much higher, closer to C2, whereas your posterior scalene doesn't really come into play until about C5. So, but they're all connected to the posterior transverse processes. So we're just going to work behind on the posterior aspect of the transverse processes of the cervical spine, and we're going to kind of address them as a group. So let's just palpate again. So here we go. I'm running into this wall of bone, right? It's very clear to me that this is a bony structure here. These are those transverse processes of my cervical spine, and I'm just kind of feeling them. And you can see how they start to sort of divide the neck into an anterior portion and a posterior portion. So here we go, I'm anterior and pushing back into the transverse processes. And when I just move by about a half an inch, all of a sudden I'm behind it and pushing forward. So this is a really small space that we're working on. It's only about this wide, right? So you're not really moving your fingers that much. But for middle and posterior scalene, we're going to be thinking about going behind the transverse processes. So go ahead and get your fingers on those transverse processes, go behind it, and now my finger pads, the finger pads are facing forward and pushing into the posterior surface of those transverse processes. So it's the same strategy we did for the anterior scalene, but now we're just directing our pressure the opposite way. So pressing in to the transverse processes from the back. So now I'm sinking in, I'm pressing forward, and I'm just breathing for a second. And I might even take my fingers up and down a little, up and down, just moving a little bit, trying to feel for those tubercles. Now, if there's too much muscular tension, because you have a lot of muscles connecting back here, go ahead and laterally flex your head towards the side that you're working on. Good. Slackening that tissue a little bit. And now while you're in there, let's do that sharp inhalation again and see if we feel any amount of muscular exertion underneath our fingers. So I definitely felt that. Let's try again. Definitely felt it. So see if you feel a muscle kind of knocking on your fingers, knocking on the door, trying to push your fingers out of that space. And we can just take a couple breaths here, sinking in. So sinking in, pushing forward a little bit. If you want to test where you are, you can breathe in sharply. Good. And now we're just going to move our way down. So again, I'm behind the transverse processes, pushing forward. So I sink in, I push forward, and I can think about gliding a little bit up and down, feeling for those posterior tubercles of the transverse processes. And then I can just sink for a moment. I'm going to laterally flex, side bend my neck onto those fingers. And I'm just going to breathe again. So again, this is not the hardest work you're ever going to do in your life. This is a sensitive area surrounded by a lot of sensitive structures. You want to go in with some specificity. You want to go in gently, softly, be mindful with yourself. And sometimes the best strategy here is just to pin the area and breathe and let it relax. Good, and I'm just moving down a little bit. So I might even take my other hand right now and just feel. Okay, good. So here we go, sinking behind the transverse processes. I'm going to try my sniff test again, so taking a sharp inhale, taking a sharp inhale again. There it is. Good. And I'm just pressing my fingers in, pressing a little bit forward, and I'm just breathing. And my head is still flexed in this direction. You could play with the position of the head. You could move it around while you keep your fingers pinned there and see if that creates any more opening for you. So I think that it's always effective to add in some active range of motion no matter what we're doing. So you can play around with the movement, kind of slackening the tissue and then stretching the tissue, kind of slackening the tissue and then stretching it. So posterior scalene connects all the way down to rib 2, which we are definitely not going to get to. We got a lot of muscle to get through. It'll be incredibly uncomfortable. I don't think we're going to get there. But one way that I can start to sink a little deeper is I can kind of start to elevate this arm, right? Get this shoulder out of the way. And that sort of slackens all of this tissue in the upper shoulder. And now I can put some direct down pressure. So now my fingers are facing away and they're going directly down towards my feet. And I'm going to side bend my head that direction. And now again, you can try that sniff test. Good. Good. Excellent. Just sinking into that posterior scalene. Great. We're only going to work on one side for this video, but I invite you to try the other side as well. Before you do so, go ahead and just move your neck around, move your head around, and just notice the difference in sensation between these two sides. You might even try opening and closing your jaw and notice if working on these scalenes has an effect going upwards as well into the muscles of the base of the mouth, the base of the tongue, into the throat, noticing how everything is connected. So I invite you to explore the other side on your own and really see what the effect is for you. That's all for today. If you got some value out of today's session, or if you just have some questions for me, please leave all of that in the comments below. And likewise, if you enjoy self-massage tutorials like this one, and maybe you have some specific requests for me, also please leave that in the comments below. If you liked this video, please give it a thumbs up and please subscribe to my channel. If you're interested in more self-massage strategies, you might really enjoy my brand new Self-Massage for Anxiety Relief video series or my Breath Bundle, both of which you can find in my Be Light store. If you'd like more behind the scenes time with me, including live monthly Q&As and also live monthly guided breath sessions, please consider joining my private Be Light community. And lastly, if you'd like to further support the channel, please do so by visiting my Buy Me a Coffee page. Thank you so much for watching, and I'll see you next time.